Gonorrhea is common, treatable, and nothing to be ashamed of. But here's what matters. Most women don't know they have it because there are often no symptoms at all. And if it goes untreated, it can spread upwards and cause serious complications like pelvic inflammatory disease, which can affect your fertility. So in this video, I'm going to walk you through exactly what gonorrhea is, why so many women have zero symptoms, which parts of the body can be infected, how UK testing actually works, what treatment involves, what to do about partners to avoid the reinfection trap, when it's safe to have sex again, and when you need to seek urgent help. This isn't a diagnosis, it's an evidence-based guide so you can advocate for yourself without panic or shame. Here's the thing, around 70% of women with gonorrhea have no symptoms. So if you're thinking, I would know if I had an STI, that's exactly why you might not. Let's start with the basics. What is gonorrhea? Gonorrhea is an STI caused by a bacteria called Neisseria gonorrhoeae. It can infect the cervix, the urethra, the rectum, and the throat. More rarely, it can affect the eyes. Here is why it matters, even if you feel fine. Many women have no symptoms, or symptoms so mild they are easy to ignore. That does not mean nothing is happening, it simply means testing is the only reliable way to know. The good news is that gonorrhea can be cured with the right antibiotics, but it needs to be treated properly because some strains are resistant to certain antibiotics. Now let's talk about how gonorrhea is passed on because there are a lot of myths about who gets it. Gonorrhea can be transmitted through vaginal sex, anal sex, oral sex, and sharing sex toys if they are not cleaned properly, or if condoms are not changed between use. You do not need multiple partners to get gonorrhea. One exposure is enough. And having gonorrhea does not mean you are unhygienic. It means a bacteria has been passed on, that's all. Now let's move into symptoms in women and why gonorrhea is often missed. Many women have no symptoms, but when symptoms do happen, they can include unusual vaginal discharge, especially if it is more than normal or different in color or texture, bleeding between periods, bleeding after sex, pelvic or lower abdominal pain, pain during sex, and burning or pain when you wee. If the infection is in the rectum, symptoms can include rectal pain, discharge, or bleeding, but it can also be completely silent. If the infection is in the throat, it often causes no symptoms at all, or it can feel like a mild sore throat. Because these symptoms can look like BV, thrush, UTIs, hormonal spotting, or cervical irritation, it is easy to self-treat or wait it out. But if something feels new, persistent, or out of character for you, testing is the most helpful next step. So when should you get tested? It is worth testing if you have had a new partner, you have had unprotected sex, a partner has tested positive or has symptoms, you have symptoms like unusual discharge, pelvic pain, bleeding after sex, or burning when you wee, or you simply want reassurance. Peace of mind matters too. Now for the urgent signs. If you have severe pelvic pain, fever, vomiting, you feel very unwell, or you have worsening lower abdominal pain along with abnormal bleeding or discharge, seek urgent assessment. This can be a sign of PID or another condition that needs prompt treatment. Now, let's go through how gonorrhea testing works in the UK, because it is usually simpler than people expect. Testing is usually done at a sexual health clinic. Sometimes it can also be done through your GP or contraception services, depending on what is available locally. Tests may include a self-taken vaginal swab, which is often used to test for gonorrhea and chlamydia, a throat swab if you've had oral sex, a rectal swab if you have had anal sex or rectal symptoms, and sometimes a urine test, depending on the clinic and your anatomy or symptoms. In some cases, especially if gonorrhea is suspected or confirmed, the clinic may take an extra sample to check which antibiotics are likely to work. This matters because treatment choices can depend on local resistance patterns. And you can ask directly Can you test all relevant sites, vaginal, throat and rectal, based on my sexual practices? That is not awkward. That is accurate healthcare. Now, let's talk about treatment, because gonorrhea treatment is not always just a tablet you take at home. In the UK, gonorrhea is often treated in clinic with antibiotics, sometimes as an injection. The exact treatment can change depending on current guidance and resistance patterns. The most important point is this: do not try to self-treat gonorrhea with leftover antibiotics. Incomplete or incorrect treatment can fail, and it also contributes to antibiotic resistance. Your clinic should explain what treatment you are having, whether you also need treatment for chlamydia, because co-infection is sometimes considered, and what the next steps are. Now let's cover the part many people dread: partners. If you test positive, recent sexual partner or partners will need testing and treatment too, even if they have no symptoms. This protects you from reinfection, and it also protects wider public health. Sexual health clinics can help with partner notification. In many cases, they can do this confidentially, and they are used to handling it in a calm and sensitive way. And it is worth saying clearly, needing partner treatment is not a relationship failure, it is infection control. Treating only one person can allow the infection to bounce back and keep the cycle going. Now, for a question people often ask quietly: when can you have sex again? Follow your clinic's exact guidance. In general, you will be advised to avoid sex, including oral sex and sex toys, until you have completed treatment, your partner or partners have been treated, and any recommended waiting period has passed. This is not punishment. It is how you break the reinfection loop. Now, let's talk about follow-up. Do you need a test of cure? Because antibiotic resistance is a real issue, clinics often recommend follow-up testing after treatment in certain situations. Your clinic will tell you what applies to you based on where the infection was found, for example, the throat, the treatment you were given, your symptoms, and local guidance. Also, even when a test of cure is not needed, many services recommend retesting later. Reinfection can happen, not because you did anything wrong, but because real life is messy and prevention is not perfect. What to say at your appointment so you leave with a clear plan? You can say, I would like an STI screen, including gonorrhea and chlamydia. You can describe your symptoms clearly. For example, I have unusual discharge, bleeding after sex, pelvic pain, or burning when I urinate. You can ask, can you test all relevant sites, vaginal, throat, and rectal, based on my sexual practices? And if the test is positive, ask, what treatment will I have, and do I need follow-up testing? You can also ask, how do we arrange partner notification and treatment? And when is it safe to have sex again? If you ever feel dismissed, come back to the main point. I want testing for gonorrhea and appropriate treatment based on the results. Gonorrhea is common, treatable, and worth taking seriously, especially because many women have no symptoms, and getting the right treatment matters. Next, tap the thumbnail on screen for chlamydia, because it's the other common infection people mix up with gonorrhea, and it's the one where fertility questions come up a lot.